Sadasivarao Yalamanchi from Diabetes Specialty Center, Vijayawada, and I'm a practicing diabetologist for the past 35 years, and I see a lot of diabetes patients with hypertension, and hypertension is a serious problem and unseen, asymptomatic. Patients don't have any symptoms, and it's also called as the silent killer. And so today's discussion will be on what is high blood pressure and how to prevent it. And so generally everyone would like to have a healthy or normal blood pressure or healthy life. So it's very important that not only we get our checked up or blood pressure checked up annually if we don't have it, or very quarterly, and frequently if we have blood pressure, and try to keep it as normal as possible. So basically each time when the heart beats, it pumps blood into the blood vessels, and this creates pressure against the walls of the blood vessel, and this is called as the blood pressure. So blood pressure usually is in two denominators. Once you have the systolic blood pressure, which is on the upper one, and the diastolic blood pressure, which is on the below one. So usually it is around 120/80, means 120 is systolic blood pressure, 80 is diastolic blood pressure. So usually normal person should have blood pressure below 130/80, and if it's above 140/80, I think it's time that we started trying to intervene by adopting lifestyle modification, and also trying to start medication on the advice of the your consultant physician or your general practitioner. So it's very important that we get ourselves checked up regularly. And so every time it's not possible for us to go to the doctor to get the hypertension checked up. So everybody should try to get a BP apparatus. It's also called the sphygmomanometer. And now we have got very good apparatuses wherein very accurate BP recording is done with the electronically made ones. And so everybody can get their BP checked up in their own houses, and it's called as home monitoring of BP. So sometimes some people have fear of this thing. So when they go to the doctor, their BP goes up, or if they go to the hospital, their BP goes up. It's called as white coat syndrome. So what we say is that we ask the patient to check up the blood pressure at home, so that if it's normal, that means we don't have to use any drugs. So that's very important. And sometimes the morning BP can be normal and evening BP can raise. So it's very important that we monitor blood pressure 2 or 3 times in a day, and even take it to the doctor, wherein he tries to correlate the readings in his clinic and the home BP monitoring reports, and then try to give out the advice. So there are various factors. We can say that some factors which are within our control, and some factors which are not on our control. So I think one thing is the age. As age advances, there's every chance of the blood vessels stiffening up. And so there's every chance of the patient BP going up. So it's very important that we try to assess the stiffening of the arteries regularly, and try to, if possible, bring it down. And also family history is also important. So people with family history, if the father, mother, or their uncles and aunts have hypertension, just like the patients have blood sugar, there's every chance of them getting diabetes. Even hypertension is also familial. So we should, if anybody in the family are hypertensive, it's very important that we get ourselves checked up from a very early age and try to control it or prevent it. And next thing, the dietary approach. Other things which are in our control is we can adopt a good lifestyle, like by doing walking regularly, by avoiding stress. So avoiding stress means by walking, we can avoid stress, by doing yoga, and also by doing meditation. All these factors. And most important thing is lifestyle modification is first is exercise, second is diet. Diet is excess salt intake should be avoided, and we call it as the DASH diets. So not eating enough foods with potassium can increase the blood pressure and the risk of stroke and chronic kidney disease. So what happens if BP is not controlled means we can have thickening of the heart vessel, heart muscle can take it up. It's called as hypertrophy of the heart, and then even then coronary artery disease can occur, and we can have a stroke, or there can be kidney problems. The patient can have a kidney problem, or he can lose his vision. Also, if BP is not under control for a long time. So when you look at the risk factors, like taking the following unhealthy diets, not following healthy activities, not doing exercise, patient being obese, taking a lot of excess food, and all these things can lead to obesity. Obesity can cause hypertension. Like that, even smoking is another risk factor which can be avoided. Another thing is taking alcohol can also increase your hypertension. It's very important that we try to avoid alcohol. So the risk factors are we should adopt a healthy lifestyle, like doing regular exercise, healthy diet, quit smoking and alcohol intake, and stress management should be adopted, and adherence to medication. One of the most important things is we should take our medication regularly. We know a lot of people, patients, or even our own relatives who have missed their tablets for a couple of days and they had a cerebral bleed and died. So, or they were incapacitated for a very long time before they died. So it's very important that we should take BP very lightly. So just as other diseases like diabetes, we should also get ourselves monitored regularly, take the medication as per the advice of the physician. So coming to the diet, a healthy diet should be adopted. Diet plays a very important, crucial role in controlling blood pressure. We call it as the DASH diets. And so, I mean, eating a DASH diet that is rich in whole grains, fruits and vegetables, and low in dairy products, and also avoiding salt or reduction of salt, fried foods, and avoiding saturated fat and cholesterol can lower one's blood pressure by up to almost 11 millimeters of mercury. And also doing a regular exercise can reduce BP by up to 5 to 6 millimeters of mercury. So very important is another thing is the see the food labels. So what amount of sodium is there in the diet, and avoid the packaged foods. So eat lower processed foods also. We should avoid processed foods as they contain sodium, and add extra salt should not be added to your diets. So adherence and to medication is the most important thing. And at last, I would like to suggest that there is nothing more precious than having a fit and healthy living, and adopting a healthy lifestyle can help us to enjoy long and healthy life. High blood pressure can be prevented and controlled in many ways. Keeping blood pressure in normal range is very important in preventing cardiovascular and renal problems. It is very much possible to maintain normal blood pressure levels with regular monitoring and preventive care. Thank you.